Everyone would join me for the invocation from our chaplain, John Gerhardt.
You, Chairman Carter. May we bow our heads together and pray. Lord, it has been quite a season. As you well know, we have faced record numbers at our hospital this past year, and especially the past several months. So we pause as we begin this meeting of our hospital board to ask that you give us grace and strength for the challenges at hand. Grant us patience and wisdom to care well for those who come to us in need. Refresh our weary staff who labor nonstop, both day and night, caring for the afflicted and the infirm. Bless the works of our hands and bring healing to those in our care according to your will. And for those we cannot cure, grant them your mercy and grace in their hour of need. Bless our leaders and our hospital board with insight from heaven above as they seek to guide and direct this great ministry of healing that we call Sarasota Memorial Hospital. These things together we pray. Amen.
Please join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I want to call the meeting to order of the Sarasota Memorial Public Hospital Board, and any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. And we'll start today. I think you may notice that we have an empty seat at the board table today. Alex Miller has resigned to run for the Florida State of Representatives in District 72. Alex has served on the hospital board since 2012 and taking several key leadership roles, including first vice chair of the board and chair of the Quality and Governance Effectiveness Committees. She also has served on the board of Physician Services, Inc. We thank Alex for her excellent service to the hospital board and her invaluable contributions to the success of the health system. She has brought extensive experience in the realms of finance, quality, and supply chain management as a result of her years of experience as CEO of Mercedes Medical, a national medical distribution company. She also provides a vital perspective to the board as a longtime resident, mother of 2 children, born in Sarasota Memorial Hospital, and a business owner. In the coming weeks, the hospital board will appoint a replacement to fill Alex's Central District Seat 1 with the general election in November. So, let's start with approvals of the orders of the day. Do I have a
Anyone
motion?
want to move?
So moved.
Second.
We have a motion and a second. All those in favor, please indicate by saying yes.
Yes.
Opposed? Orders are approved. Thank you. Next, we'll do the approval of minutes of the meeting of February 16th.
Second.
We've got a motion and a second. Any additions, questions? All those in favor, please indicate by saying yes.
Yes.
Opposed? The minutes are approved. Thank you. Then our next item is the First Physicians Group update with Dr. Jack Rodman, Chief Medical Officer of PSI.
Thank you. It's a pleasure to be here, and I want to thank the board for allowing me to have this opportunity to update you on First Physicians Group. So we're now into our 22nd year as First Physicians Group in serving our community. We had very simple intentions at the beginning back in 1994 to really secure a quality group in a community that had a lot of variability in the types of doctors that work there. And through the years, we've really had an amazing transformation. It's been an evolution, if you will, and it has really been fueled by many of the forces that have changed healthcare. And today, as we sit here, we are now 107 physicians. We're 34 advanced practice professionals. We have 23 specialties, and we're represented at 21 sites throughout the community. I put this up here just to talk about our organizational mission and vision, and I'm very proud of this because this document is actually 20 years old. And it wasn't long after we had our inception that we were practicing as it was actually 4 groups. And they were independent. They were working in solo groups. They were very much not a group. And we looked at each other, and with the support of the board, we really got in a room, a group of doctors, and we gathered as physicians, and we spent time and energy really defining who we were and what we were about to be in the future. And I will tell you that time, that support that we had has really been instrumental in becoming who we are today. We created the mission and the vision and the guiding principles, and it was a culture change. And that culture change really lives even today because it was created by doctors, it's supported by doctors, and as a result of that, we have engaged and committed physicians. So as I read cohesive medical group, patient focus, doctor-patient relationship, highest standards of care, quality patient outcomes, a commitment to patient satisfaction, empowering our employees, sound management, and integrity, those are still today a fundamental key to our success. So who are we? Our roots lie in primary care. We're family practice, internal medicine, pediatrics, and pediatrics alone as a practice. And that's really one of our 3 distinct components that make up First Physicians Group. We also are a hospitalist medicine, and this has evolved over the years. We've all watched this nationally and locally evolve, and it's a changing culture. It's a changing culture in how we educate through GME. It's a changing culture in how we manage both the outpatient and inpatient practices of medicine. And through this, we've evolved with medical hospitalists, psychiatric hospitalists, surgical hospitalists, and neurohospitalists. Our third specialty and component of what makes up First Physicians Group is the specialties itself. And we have dermatology, thoracic surgery, cardiovascular surgery, women's services, gastrointestinal oncology, orthopedic trauma, general surgery, pain medicine, geriatrics, and palliative care. That's a growing list, and that list provides really the most specialized care that we have in this community. We support specialists that are vital to the community as a safety net, and we also support specialists that could not manage here alone without the support of our system and our board here. I wanted to just review our network of services, and this really demonstrates our scope and breadth of services throughout the area. We're located as far north as State Road 64 at Heritage Harbor, and we're as far south as Toledo Blade and our Northport Emergency Room. Again, 21 sites, and we've had great success coupling our urgent care with our primary care practices, and we've had great success doing that. And we look for ways in the future to continue to grow primary care. A bit about our facts and figures. In 2015, our total patient visits were just under 319,000. Our surgeries were just under 16,000, and they range from dermatologic procedures to the most complex cardiovascular cases. We averaged 1,279 new patients per month into the system through First Physicians Group. And something I'm proud of, we managed this with 227 employees. And this really speaks to the fact that we're lean, we're efficient, and we really appreciate our team of superstar staff and employees. Our patient revenues were $45 million. To talk about provider growth, as you look at this graph, we've nearly doubled our size since 2010. And if you look at since 2014, we've had 33% growth in the number of providers within First Physicians Group. This looks really aggressive, but what I would tell you is that we've been very cautious and very deliberate in our growth. We've looked really only for the most high-quality, top-tier doctors, and we've really worked hard to establish a process to onboard physicians so that they're successful as they join our organization and enter this community. I want to just turn a little and just describe a few of our programmatic successes. And I want to start with cardiovascular and thoracic surgery. Back in 2010 and 11, for a host of reasons that the board is well aware, we weren't quite content with our cardiovascular program and really wanted to take it to the next level. And we engaged a national search that led us to Dr. Jeffrey Sell. He's an accomplished surgeon, an outstanding physician leader, and with his help, we partnered with Columbia University. And since that time, we've brought in a team of surgeons and staff that are really second to none. As you look at our huge growth and volume on the table above, that just impacts the importance of having the senior leadership of Dr. Kelly, Dr. Vesco, Dr. Hoffberger, Dr. Fong that joined Dr. Sell. Since Dr. Sell's arrival, there's been a 42% increase in the total number of cardiovascular and thoracic surgeries. When you look at 2015 alone, we had 970 cardiac and thoracic cases here at Sarasota Memorial Hospital. I want to mention two other successes. One is the GI oncology. It's a brand new program. We brought in Dr. Ken Meredith, who's really one of the world-class leaders in the complex cancer surgery of the esophagus, pancreas, hepatobiliary systems. And these were cases that would very often leave our community and many times leave our state, going to tertiary and cancer centers all over the United States. And since his short tenure, we've done 121 surgeries that would have left this system, and providing world-class surgery, world-class outcome to our community. And finally, I want to just mention maternal fetal medicine. This program has been serving our community for over 20 years. Dr. Felice Barron and Dr. Lene Savage, they attend to 2,500 of the highest risk pregnancies every year in our community. And this service would not be possible without the backing of our system, and I thank you for that. First Physicians Group, one of the goals, it's been important for us to stay ahead of the curve. And as we look at national trends, we've been involved in many and all of them actually. And just to mention a few of these, Eye Care Sarasota is a clinically integrated network. It's a team of hospitals, employed physician groups such as First Physicians Group, and community physicians that work together to really focus on the triple aim of quality and efficiency and patient satisfaction and experience. And we've been instrumental in Eye Care Sarasota. Secondly, on the primary care side, we have a patient-centered medical home, and we are at the highest level, level 3 NCQA certification that is the highest designation for quality and patient-focused care throughout our primary care offices. Very similar to our system, patient satisfaction is a key focus in our offices, and we use CG CAPS as the national survey that we inquire on patient satisfaction within the offices. And most recently, we're a top achiever with 7 out of 7 domains met at the highest level. Meaningful Use is sponsored by CMS. It's an electronic health record incentive program. It's been present for 4 years. We've been involved all 4 years of the incentive years, and we're currently in stage 2 attestation. And we've met each of those criteria that CMS designates along the way, when now offices are actually getting penalties for not participating, and we've been very successful with that. And finally, on the business side, managing practices, and the MGMA, or Medical Group Management Association, measures top practices throughout the nation, and we are really a better performing practice is their designation that puts us in the top 10 nationally as it relates to finance and staffing and the business of managing these outpatient practices. So where are we going? I think future strategies, we talk often, and I think first and foremost is primary care growth. As we think about our community and population health, we really want to improve the footprint of primary care throughout the Sarasota County and its surrounding neighborhoods. We also are looking at post-acute care development. How do we manage folks as they leave the hospital, after they've been hospitalized and they're convalescing, whether it be in nursing homes or assisted livings or in rehab sites? And so we're putting a lot more effort into managing that part of the care of our community. We do well getting patients seen in the community. We do well managing them in the hospital. I think a whole new focus as we move towards different payer methods and different care delivery mechanisms, we want to do a better job in the post-acute setting. Next is specialty care needs assessment, and this is ongoing and it's fluid. In much the same way that I've given you the examples that we just talked about, we will continue to look at what our specialty care needs, and where appropriate for the community and where appropriate for our system, we will continue to put efforts and resources into managing the specialties within our community. And finally, we want to maintain our stability, our nimbleness, if you will, as we evolve to meet the changes of the healthcare landscape. We have payment model changes, we have models of care, we have population health initiatives, and of course, we're going to have to adapt to the changes, governmental policies and mandates that may come our way as we move forward. And in closing, I think by providing First Physicians the quality and the patient-centered care, we really accomplish what I call a win-win-win. It's a win for our providers. We have the framework and foundation that allows doctors to do what they do best, and that's to see patients and care for patients. It's a win for Sarasota Memorial Healthcare System, expanding care beyond the main campus. I feel like we are helpful in providing a community-centric presence throughout Sarasota County and its neighboring communities. And finally, it's a win for our community, providing access to top-tier and highly specialized physicians, providing quality and efficient patient-focused care to our communities. And with that, I'm done. Thank you. Any questions? Yeah.
Daryl, you have a question?
Robert, you were talking about where you're going in the future. What's your role in the residency program here?
It's huge. A lot of our doctors are involved. We have doctors that are helping to lead the residency program. We have doctors that are helping to educate the residents when they get here, and our practices will be integrally involved in the residency program. And we hope that success will pay off down the road as we expand our primary care, and our goal is to help keep some of these residents as members of First Physicians Group.
Do you expect the residents to shadow your doctors, I guess?
I do, shadow and learn, and yes, all aspects of the educational process.
Thank you.
I had a question.
Yes, Tran.
Dr. Robin, that was an excellent presentation. My question goes toward the future also. The advent of concierge doctors and services, has First Physicians Group given consideration to possibly doing a concierge service along some lines?
We've thought about it. We've talked about it. We've I think it has some obstacles, and when we think about, providing the community, it does put some restrictions on what you can do and can't do. There are some movements and legislatively and nationally that may bring some hybrid models over time, but right now we feel in many ways we take really the goal that we practice concierge medicine. We don't charge it, but we practice concierge medicine. And I think that's an important aspect of how we practice every day. And I think that speaks to the mission and the vision and the values, and having doctors that are on board and committed to that.
Thank you.
Okay.
All right.
Thank you, Dr. Rodman, very much.
Terrific.
Okay, David, our Excel winner for this month.
Thank you, Mr. Chairman. Denise Jones, can you come up and join me?
All right.
Here, come stand, if you don't mind.
Okay,
I get
that's
lonely. All right. So, our Excel recipient for the month of March is Denise Jones. Denise is a PCT on Cardiac Progressive 2. She's been an employee since January of 1997. She's described as a pleasant professional who takes excellent care of her patients and families. So, Denise, I have a couple comments from your peers. Does that make you nervous? You shouldn't be at all. We wouldn't put them in here if they weren't great. So, Denise is one of the building blocks of our cardiac floor. She is a long-time employee who is very loyal and dependable. She is a great resource to PCTs and nurses, and an excellent team player. Denise always has a smile on her face. She is engaging and takes the time to get to know her patients. She is professional and punctual during all shifts and takes pride in her duties. She is autonomous in her role and serves as a preceptor for floats and new staff. Denise constantly participates in the American Heart Association Heart Walk to benefit the organization and survivors. She is also very active in the community and her church. We're also very proud for her on this award. Congratulations, Denise. Thank you, and congratulations.
Thank you.
Don't run away, Denise. I have the actual award for you, although it says keep, so guess what? You're going to have to do this again. So we got practice. Anyway, the Excel Award recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They are superior performers that make an extra effort in the quality and care of our patients and families in the community. The hospital board, the administrative staff of Sarasota Memorial Healthcare System recognizes you, Denise Jones, with the Excel Award for the month of March 2016. Thank you for your continued dedication to excellence, and it's signed today by David Feringer, President and CEO, and Gregory Carter, Chair of the Sarasota County Public Hospital Board. Congratulations. Well deserved. Put this back on and hand it back to David, but he has some things that you can take with you.
So, Denise, we do have this for you, okay? And we're going to have you come back to Management Council. That's all right.
That's
Would you like
fine.
to say a couple comments?
Yes.
Great, we'd love to hear.
I would like to say thank you to all and all my coworkers and my supervisors and stuff. I enjoy working here and the people, and it's a great place to work. And I'm honored. Thank you.
Thank you.
Congratulations, Denise, and I see you have some of your folks from the night tour that I see on night rounds, too, so. Next, we have the report of the medical staff. Dr. Hamad.
Thank you. We have two motions that we're asking for. The first, the medical staff is requesting approval of the policy, case review, and professional practice guidelines.
Mr. Chairman, I make the motion to approve the case review and professional practice guidelines as outlined by the Medical Executive Committee.
We have a motion and a second. Any questions, comments? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
And next, the medical staff is requesting approval of policy requesting and monitoring new privileges.
And I have a motion, Mr. Chairman. I move to approve the policy for requesting and monitoring new privileges as recommended by the Medical Executive Committee.
I'll second it.
We have a motion and a second. Questions or comments? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you.
That is all I have, sir. Thank you.
Thank you, Doctor. Auxiliary report, Mr. Ed Miller.
Thank you, Mr. Chairman. Last several months have been very busy ones. 2 major projects have been implemented. Bugs are being worked out, which is operating within the capacity management initiative. The first one is a surgical support program that's almost completely staffed. Volunteers serving both morning and afternoon shifts, assisting incoming patients and families prior to, during, after the surgical process. The waiting area, almost 3 times the size of the previous windowless, cramped waiting area, is now bathed in a 180-degree window wall, creating a feeling of openness. Food, drink, and restroom facilities are close at hand. Procedure to coordinate families and visitors with recovery room visits and post-procedure doctor consultations are being well coordinated with the needs of those in waiting. The second one is the discharge program, and it's been enriched by over 25 new volunteers, including 15 teenagers. During the previous 5-week training period, these individuals have been recruited and trained upon the use of a unique discharge program app, APP, on a smartphone carried by each individual volunteer, allowing that individual to have instant communication with the patient's discharge program without he or she returning to the dispatch office. This procedure has resulted in a discharge process that is much more efficient than ever, leading to increased bed capacity. Since change is constant, we have new uniforms. And this is our new uniform. Thank you, Mr. Chairman.
Thank you, Ed. I've seen the new uniforms around the hospital, and they're very visible. Very nice. Okay, the next item is the Sarasota Memorial Healthcare Foundation. Alex Quarles, President.
Thank you, Mr. Chair. I have a brief report for you. I want to just say thank you to everybody that attended our sold-out Women in Medicine program this year. We had Doctors Fiorica, Schulman, and Meredith there to talk about oncology, and we actually had a waiting list, hoping to look for a larger venue than we had for next year as we continue to do this. Out of that group, we spun off a program called the Women's Leadership Council, which we have 22 members now of women, well-known women in the community who are going to be ambassadors for us. We will take them to certain places within the hospital. We'll invite them to various functions that they might not normally attend, groundbreakings, et cetera, and get them more involved and hopefully their friends involved so that we can spread the word there. So 22 women now have joined the Leadership Council, and we expect that in the coming year there will be more. In your packet, or what was handed out to you, is our Employee Partners in Caring program, or we call EPIC, which has been in place now for over 10 years, and it is where the employees make their own personal contributions either through payroll deduction or personal check. This is a sample of one of the pearls that they will be receiving, and we have about 6 different employees that have agreed to be visible and say why they give to Sarasota Memorial and why it's so important for their colleagues to do the same thing. Their goal is $75,000. They're also very interested in naming something in the new Rehab Pavilion, much as they did with the Courtyard Tower. So that's we're actually meeting next week, I believe, and April 1st is when the program starts. So that's a wonderful project that is just sort of taking on. And I'll just tell you very quickly, the co-chairs, there are 17 members that are employees. Of the co-chairs is Marilyn Kirchman is one, Sam Soley, and Jennifer Storch. All three are chairs of this group of 17 people who are going to solicit for support for Sarasota Memorial. So we're very proud of that. With regard to the annual golf tournament, it's scheduled for May 6th at Laurel Oak Country Club. It's almost sold out. We've got 2 full courses. We have a goal of $115,000 with $115,000 in sponsorships have already been received. We expect a net of $100,000. We have 147 golfers already signed up, and the max is 184. So that is coming along well, and that is again on May 6th, and I'm sure there's plenty of opportunities for whole sponsors and such. Rehab floor plans are now completed, and we are putting values that we will take to Mr. Verinder to decide on the value of the different rooms, as we did with the courtyard tower. And we have the annual, the information ready to go to print so that we can start doing what we need to do. The last 2 items, you've received your annual report, I hope, and it's our 40th anniversary, and we wanted to keep it simple and clean. But we also wanted to include Sarasota Memorial. Our 2nd annual fund appeal will be going out. This first annual fund appeal has already netted more than $100,000 more than last year for Sarasota Memorial. And the last item is that we will be adding staff now that the renovations have been pretty much completed in our new building. And we thank you for that, and we'll be sending a check. And that concludes my report, unless you have any questions. Thank you.
Okay. Thank you, Alex. Secretary's report, Bob Strasser.
Thank you, Mr. Chair. In March, there are 3 important dates for the board members to take note of. The first is March the 1st, Tuesday, March the 1st, 8 o'clock board breakfast, 9 o'clock quality committee, 10 o'clock Finance Committee, 11 o'clock HR Committee. The second is on Monday, March the 21st, 11 o'clock review of finances, 11:30 peer review, and 1 o'clock the public board meeting. And the third, and probably a very important one, is on March the 30th is Doctor's Day, in which most of the board members come in early, starting at 6:30, greet all the doctors and thank them for their dedication to Sarasota Memorial Hospital. And that's all I have. Thank you, Mr. Chairman.
Okay,
There's
thank you.
something else that day, too. I just
Yeah,
might
there's a
add.
birthday that day, which I didn't want to. I didn't think she'd want me to mention it.
39.
I won't say who, but she's to my right.
April as well? Yeah, April.
We're going to do April?
Yeah, go ahead and do
Oh,
April,
this is
too.
March, isn't it?
It is.
Oh, that's all right. I'm okay. It's not
You've had a cold.
excuse me, it's not my day-to-day.
Who are you? What'd you do with Bob?
I don't know. I lost it. There are two dates. Well, this third one is still good, the Doctor's Day. That's still coming up. On April the 6th, we have a board breakfast, residency program, quality committee, mission and planning, and governance. And 12 o'clock, an audit committee meeting at 12 o'clock. On April the 18th, we have a 11 o'clock review of finances, 11:30 a.m. peer review, and 1 o'clock public board meeting. And that includes, I'm sure I'm on the right month now, Mr.
You
Chairman.
are.
Thank
Good.
you very much.
Thank you very much, Bob. Treasurer's report, Joe DiVirgilio.
Just one item for the board today, and it's in regards to approval of the bad debt and charity care. And I propose the following motion. I move approval of the bad debt and charity care for the month ending February 29th, 2016, in the amount of $12,576,000.
Second.
We have a motion and a second. Any questions, comments for Joe? If not, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you. Operations report, Chief Financial Officer Bill Wolchin.
Good afternoon. Thank you, Mr. Chairman. I have the financial highlights for February 2016, and February was our 5th month of our fiscal year. So the fiscal year to date
numbers represent 5 months of activity. Looking first at operating revenue for the system, we had operating revenue of $61,734,000 in February against a budget of $56,756,000. Fiscal year to date, operating revenue stands at $289,126,000 compared to a budget of $279,432,000. Looking at the system's total expenses for February, actual $58,584,000 compared to a budget of $54,792,000. Fiscal year to date, total expenses $280,161,000 compared to a budget of $274,141,000. Looking at the system operating income for the month of February, $6,002,000 for an operating margin of 9.1% compared to a budget of $4,713,000, operating margin of 7.8%. Fiscal year to date, operating income $22,914,000 for an operating margin of 7.4% compared to a budget of $19,001,000, which generated the budgeted operating margin of 6.4%. Moving on to statistics for the hospital, and these are February year to date, so 5 months of activity. Average daily occupancy, 483 compared to a budget of 444. Admissions, 13,231 compared to a budget of 11,615. So far this fiscal year, our length of stay on average has been 4.68, whereas a year ago it was 4.74. The hospital's surgery cases for 5 months, 8,838 against a budget of 8,574. So far through 5 months, we've had 1,408 births compared to a budget of 1,457. Outpatient registrations for the system, 180,601 compared to a budget of 181,416. Emergency care center registrations, 52,362 compared to a budget of 46,632. And for case mix index, so far this fiscal year, all patients 1.87, and for Medicare patients 1.98. Thank you, Mr. Chair. That concludes my report unless there's any questions.
No questions for Bill? Thank you very much, Bill.
This one's tricky.
Our next operations report will be Lori Lang as Chief Operating Officer.
Thank you, Mr. Chairman and members of the board. I'm pleased to provide the operational report for the month of February. We've all seen this graph before, but I thought I'd share our average daily census by month for fiscal year 16 as compared to the previous 3 fiscal years. And you can see that our average daily census for the month of February was 564. And while that was the average, our peak was 674 for that same month. And if you look from fiscal year 13 to fiscal year 16, we have enjoyed in the month of February a 32% increase over that period of time. So we've had many initiatives in place to deal with our growing census and growing demand for our services. And one of the things that we instituted and opened was the Departure Lounge, which allows patients that are ready for discharge but aren't quite ready to go home because of a ride or waiting for medications to be delivered from Walgreens. We've created this beautiful space for our patients to go and rest comfortably before they start their journey home. This is the view from the north side. This is the south side. We do also know that many of our patients will wait until they've had breakfast or lunch to go home because either their loved ones have spent all their time coming to visit them. I'd like to think it's also because our food is very good. But either way, one of the things that we've done in the discharge lounge is offered food for breakfast, for lunch, and for dinner. Things like oatmeal, continental breakfast, soup, and wraps. And one of the nice things that we've started doing is actually sending something home with them when they go, because many times they go home to an empty refrigerator. And our patients really are worried when they get home that will they have something for their next meal. So we send a cup of soup or a wrap. And last week when one of our patients came down, she exclaimed, "This is for me." And then when she was leaving, she said, "It's like a kiss goodbye." And what a lovely gesture and comment for them to leave our care. The other initiative that we started was recapturing patient rooms because we knew we would have a significant growing demand for our services this year. And to date, we have recaptured 15 rooms that were previously offices for managers or break rooms or storage closets. These are 2 examples of rooms that we've put back into order. We have 5 additional rooms that will be put back into place in the next several weeks. What we've had to do to reclaim those rooms is make multi-purpose rooms for our staff. So the picture on the left was actually a locker room, lockers for our patients. We put in a sink and a refrigerator, and now it has 2 purposes: a place to keep our staff's items while they're working very hard, and also a place where they can store their lunch or their snacks during break times. The picture on the right is a picture of what we put on most units, which are smart boards, which shows our discharge milestones for our patients so that everyone is on board on what are the things that need to happen for that patient to go home safely. If we move from inpatient to outpatient, I'm happy to share that we're celebrating our 10 years of having urgent care centers as part of our system. The program started with just one location at University Parkway in early of 2006, and that year we saw just 4,000 patients. Over the past 10 years, our program has grown to have locations in 5 different areas, and we'll be adding our 6th in October at St. Armand's Circle. The urgent care team is on pace to see over 90,000 patients this year, and we have treated over 330,000 patients over the last 10 years. A shout out is required to Dr. Cam, Dr. Holland, and Dr. Gerber, who have partnered with Jennifer Storch and with Frank Morgan, and they've all played a critical role in developing this very successful program where we've created opportunities for our patients to be cared for close to their home. And in doing so, we are pleased to state that we have maintained our patient satisfaction scores at the 85th percentile or higher since its inception. Also, in our emergency department, we have something called JMR, and in that space is where we treat some of our less urgent patients. We knew that the care that we want to provide there is quick but efficient, and we had a general radiology unit that had surpassed its life and was just a room that was no longer in use. So earlier in this fiscal year, we approved a general radiology piece of equipment to be installed. It was operational the 2nd week in February. And now our patients don't need to go completely through the emergency department to have radiology studies completed. On average, about 22 patients in the JMR require radiology studies, and our average length of stay is just a little over 2 hours. And so this added piece of equipment has helped with throughput, and as you may know, about 1/3 of our patients that go into our emergency department are seen in JMR. So in February, it's about 2,400 patients, and the emergency care center saw about 8,000. And then finally, our interventional radiology program has been wildly successful, and so we're sorry to say goodbye to Dr. Daniel Brown, who is an interventional radiologist who is leaving Radiology Associates of Florida, who left on March 11th to move to North Carolina to be closer to family. But I am pleased to state that Fred Moshlin, a physician from my hometown of the University of Maryland, will be joining us, where he was the chief of interventional radiology at the University of Maryland. He will begin on September 1, 2016, but in the meantime, Dr. Stube, a partner in Radiology Associates of Florida, who practices mainly in Tampa, will be spending more time here during the week, so we don't fall short in our physicians providing interventional radiology. If there's no questions, that concludes my report, Mr. Chairman.
Okay, thank you, Lori, very much. Now we'll move to committee reports and start with Finance Committee. Bob Strasser.
Thank you, Mr. Chairman. I read them a month last few weeks ago, and I did it on purpose just to see if everybody was paying attention. I couldn't say.
Well, good. Thank you for that, Bob.
The committee met on March the 1st. Item discussed was home and health transition. Russell Lane discussed the merger of SMH Home Health into Baycare, Care, 2011. They widely merged home health agencies, provided a history of Sarasota home care prior to the merger and the financial return. Maria Madison, Director of Sarasota, and she discussed the post-merger operations. She provided a map of Southwest Florida showing the various DHC services, Sarasota Memorial Home Care Office, Sarasota and Charlotte counties. Arnold discussed expanded services that are provided with, which include oxygen and services, pharmacy, feeding supplies, and protective products. Growth in home admissions were discussed for the three counties of Sarasota, Renovated, and Charlotte counties. Steady and rapid growth. HMS was able to retain its name for recognition and able to increase our territory. There have been growth each year, admissions, as well as growth in care admissions. One of the further imaging patients, high delivery of oxygen and other home care disease management programs were discussed. SMH Home Care received a 5-star rating for CMS. The second item was debt structure. Our complex debt structure continues to produce a low-cost capital, which saves the organization millions of dollars in interest. It is a mix of fixed and variable debt, combined with interest swap agreements. SMH recently reduced exposure to bonds by entering into 2 10-year bank loans. Bill Hogan reported on the bond and swaps summary, debt service, and why interest rate swaps were used. Discuss the financial complex debt types of debt. Third item was a follow-up of financial ratio history. Also named the SMA 2005. This shows strong improvements in financial time period that is the bed tower, campus improvements, additional funding of the medical fund, trauma centers, for a graduate medical residency program. Doesn't by our statistics since the year 2005. That concludes my report.
Thank you, Bob, very much. Next is Human Resources Committee. Joe DiVirgilio.
Thank you, Mr. Chairman. The Human Resource Committee met also on March 1st. Lori Bennett provided the strategic roadmap with regard to the HR strategy and creating a robust workforce, which is one of the major focuses for the organization this year. She stated that the strategies align with the organizational roadmap and the respective areas of focus are aligned with the increased needs for talent. Susan Curran reviewed the performance management goals and areas of focus for 2016, including talent development goals and focus areas for future further development of the diversity programs and talent gaps. Measurements of success were discussed in the areas of turnover, merit and recruitment. The success of the HR department is dependent upon attracting, motivating, engaging, and retaining talent to meet our capacity needs. That completes my report.
Thank you, Joe. And our last committee report is the Quality Committee. If you would, Dr. Malone.
Yes, the Quality Committee also met on March 1st, and as it is a closed committee by law, I have no report at this time.
Thank you. President's report. David Werner, CEO.
Thank you, Mr. Chairman. So I'm going to start today, as I always do, and look at our February 2016 year-to-date report card, organizational report card. So we start in the category of service pillar and look at our HCAPs for our inpatient domains. We have a goal of hitting 9 out of the 11 at a greater than 50th percentile. I will tell you that we fell a little short this month and have gone to 7 out of 11, and I'll show you the detail on that here in a minute. We also have a goal of having our outpatient HCAP domains at being 55 of 58 being greater than 50th percentile. We fell a little short there as well at 53. And once again, show you the details where that came in just a minute. In the people pillar, we have a goal of having turnover of our full-time and part-time employees that have been hired within the last 12 months of being less than 34% turnover. We're a little bit higher than that. We're at 35.73. So we're still adjusting to that goal that we kind of set out this year. On happier terms, I'm looking at the quality pillar, and we had a goal of being at 0.95 or less this year, which the national average is 1.0, and I'm happy to report that we're a good bit below that at 0.88. In the finance pillar, Bill has already reviewed this. We have organizational finance. Our goal is being at 5.2% margin. We are exceeding that and anticipating 5.7% by end of the year. In the growth pillar, we have our inpatient admits, which is also inclusive of observation patients. We have a goal of being at 35,301. We are exceeding that goal and are at 39,230. On the outpatient registrations, we had an aggressive goal of 747,000. We're a little bit short of that. We're at 745,000. So when we look in our HCAPs a little bit closer, you can see the 11 domains there on the left-hand side. And in the middle column where it shows a total of 7, those are our current scores. And you can see that we are missing on 4 different goals. Some of them being only missing by a point, but missing nonetheless, and we do have a number of services or actions around these goals. But keep in mind that the House is extraordinarily busy, and some of that plays into this. The one I do want to point out, though, is if we look at our overall hospital rating, we're at 81, where our national average is 71, so we're exceeding that quite a bit, as well as recommend the hospital at 86, which national average is 71. So I think that we're being very well received still. Looking at our outpatient system report card for the what you will see is we're hitting 53 out of 58 of our domains here. So we do have a gap on our ambulatory surgery and our emergency care, and both have action plans around those. I will tell you once again, the emergency care is extraordinarily busy right now, and as well as the House. So we are working to alleviate stress each and every day and anxiety. Moving on to people, we have our Tour de Cure to Benefit, which is American Diabetes Association. So Sarasota Memorial, under the leadership of our Chief Operating Officer, Lori Lang, is gearing up for American Diabetes Association Southwest Florida Tour de Cure in Lakewood Ranch on April 10th. Currently, the SMH team has 20 registered riders, and we're always looking for more. Is that right, Lori? Okay. So we can contact, you have the contact information there to follow up on it. I know you guys have been practicing all the time, right? Yes. Thank you. Staying in the people section, we had our 2016 Black History Month. Our Hall of Fame inductees were announced. So Black History Month came to a close in February with the induction of 4 outstanding employees into the Black History Month Hall of Fame. At the special ceremony were 2016 inductees from left, hospitalist Dr. Wayne Blake, Nora Battius of Cape Surgery, Barbara Dixon of First Physicians Group, Internal Medicine and Pediatrics Practice at Blackburn Point, and Hospitalities Services Lead, Grady Law. So thank you and congratulations to all of them. We received a pleasant surprise this past month where SMH was named a Truven Top 100 Hospital. It's an award we've received a few times in the past, and it's really the gold standard for hospital rankings, and just thrilled to be able to come in and tell you about it. Sarasota Memorial was named among the nation's top 100 hospitals for overall performance in the Truven Health 2016 study of nearly 3,000 hospitals. The award recognizes the top 100 hospitals that demonstrate the best patient safety practices, superior outcomes, and consistent use of evidence-based treatments while maintaining high patient experience scores and low hospital cost. So I'll tell you that none of this happens without our 5,000 employees and our 900 physicians that work here each and every day. And also thank you to the board for its leadership on that. We also received this the other day. SMH receives a blue distinction for hips, knees, and spine from Blue Cross Blue Shield. The Blue Distinction Specialty Care is a national designation program recognizing healthcare facilities to demonstrate expertise in delivering quality specialty care safely, effectively, and cost efficiently. The goal of the program is to help consumers find both quality and value for their specialty care needs while encouraging healthcare professionals to improve the overall quality and delivery of care nationwide and providing a credible foundation for local blue plans to design benefits tailored to meet employers' own quality and cost objectives. So quality remains the key. Only those facilities that first meet nationally established objective quality measures for Blue Distinction Centers will be considered for the designation as a Blue Distinction Center. So thank you to all of our teams that participated in that. Our vascular labs also received an accreditation this past month, so congratulations to our vascular labs, including off-site urgent care locations, for achieving accreditation from the Intersocietal Accreditation Commission, an organization representing multiple disciplines, all dedicated to ensuring quality patient care, promoting health care, and supporting one common mission, improving health care through accreditation. We put this in the growth category, but wanted to call out our lab team and IT team that just went through this transformation this past year. So late last year, the lab celebrated the go live of the new SunQuest Laboratory Information System, which processes, stores, and manages data at all stages of analytics, from patient check-in to specimen processing and reporting. Successful implementation of the new system required the efforts and expertise of a multidisciplinary team over the course of 17 months. So many thanks to all involved, and thank you to the board who also paid for this, which was several $1 million to go through this. It was I will tell you, it's a massive change when you go from a system that you've been running for around 20 years to a new modern system, and lots of ups and downs, but the team came together and got through that very well. You may have noticed we have a whole lot of construction going on behind where the old Rudder building used to be. It's our new Rehab Pavilion construction. I think we do still have a camera going all the time in the main hall if you want to stop by and take a look at what's going on. So the utility trench work has been completed. The new West Campus Road is in process. I believe that opens up this week or next, so very, very soon. And all the steel rebar is on deck. And I will tell you, I've met with our construction department, as well as our contractor last week, who still guarantee me that we're on budget and on time, and we'll have this thing open by the end of this December, out of this calendar year. So more to come. And then finally, some people are on spring break now, some just got off of it, and we seem to be taking care of all of them, so glad to do it. And thank you for the time.
Any questions for David? Thank you, David.
Good report.
Thank you.
Consent agenda. I don't think we have anything on the consent agenda. Public comments, Donna?
No public comments.
No comments. Legal matters, Carol Ann?
I have no report.
Any other business for the board? Seeing none, we are adjourned. Thank you very much.
Yeah, a week early.
Mhm.